Welcome to episode 1 of Speak Health's Doctors.
Oh, you thought we was done. No. There's more. So there's actually a few other reasons why your appointment might be pushed out a little bit further. Let's talk about it. It could be an insurance issue. There's actually insurance limitations that could be why your appointment could be pushed out a little bit further. Things like referrals. Does your insurance require a referral? That can be a reason why your appointment could be pushed out a little bit further. Please make sure you do the research on whether you need a referral or your deductible or anything like that before you schedule your appointment. Another thing you can do is ask them if they have a cancellation list. A lot of practices do, but some don't. But a cancellation list, they can put you on it after you schedule your appointment, and they will call you if anybody cancels an appointment. Unfortunately, usually they'll call you last minute if somebody cancels their appointment to fill that slot. But hey, at least you get in sooner. And like I mentioned before, some offices do have same-day slots. Always ask when you're scheduling your appointment if they have same-day slots. Usually they are reserved for urgent appointments, but depending on what you're being seen for, sometimes you can get in. Another thing to always consider is why you're being seen. Are you being seen for new symptoms? Are you a new patient? Is this a follow-up appointment? Do you have multiple issues? That also will determine where you're going to be placed on the schedule. Something to consider that most patients don't know, that on a schedule, there are certain appointment slots. And depending on the clinic, each slot allots for about 15-30 minutes to an hour. And depending on what you're being seen for will determine on where you're being placed. So for instance, if you're a new patient, most offices want to allow for at least 1 hour to give you enough time to get to know your doctor and the doctor to get to know you. So since they need a whole hour slot, those are hard to come by on a schedule. So that's another reason why your appointment might be pushed out a little bit further versus an appointment that might be a follow-up that would be a 15-minute slot. But please don't lie about why you're being seen. Reason being is if you say that it is just for a follow-up, but you need more time with your provider. A follow-up genuinely is about a 15-minute visit, but you actually need 30 minutes. If we put you in a 15-minute slot, that could put the provider back time if you actually need 30 minutes. So please always be honest as for the reason you're being seen. Trust me, I know scheduling appointments can be a handful. But as long as you come armed with the correct information, we can do this together. If you have any questions, let me know. We'll be back for more.